Welcome to Purchase Broadcast Studios. I'm your host, Gracie Wenner. On August 7th, 2024, Melissa Glazer, the Dean of Student Affairs at Purchase College, announced that the college would no longer offer health insurance plans for domestic students. This decision sparked concern among students who may face challenges finding affordable, comprehensive health coverage. This decision means students must find their own coverage, either through a parent or guardian's plan or through the New York State marketplace. While the college assures that on-campus services are still available through the student health fee, any off-campus care, such as urgent care or hospitalization, requires private insurance. The changes left many students concerned about affordability and access to essential health care services. To help us understand the implications of this decision and what resources are available, we're joined today by Elizabeth Estony and Ines Alvarez, representatives from NYPIRG, the New York Public Interest Research Group. NYPIRG is a nonprofit organization dedicated to empowering New York citizens and advocating for issues that affect them. Welcome, guys. Thank you guys for being here.
Thank you for having
us. So my first question is, can you guys explain what NYPIRG exactly does and how it supports students, particularly on issues like healthcare?
So I guess I'll just start by saying a little bit about NYPIRG. So we stand for the New York Public Interest Research Group. So we're a New York-based nonprofit organization. And how it works is we have chapters all over SUNYs and CUNYs and some private schools, but the majority being public education in New York. And we have interns, and we work together on different campaigns, one of them being public health. That's one of our big campaigns, especially right now. We do other things with like the environment, higher education, and we work with like local legislative, New York-based local legislative laws so that we promote. So healthcare is, a large part of that.
One of the things I want to add is student empowerment.
Mm-hmm.
So it's run by a student for the students. So the students, they choose which campaigns we're working in each semester. And actually, last semester, they chose the New York Health Act.
Mm-hmm.
The board members, usually they choose the environment, but last semester they chose that, and it goes all through the year. So one of the things the students do is call the representatives and advocate for the universal health care. That's it.
Yeah.
Cool. So what roles do each of you fulfill in NYPIRG?
I'm the project coordinator here at Purchase, and Lisa is one of my interns.
Yeah, this is my second semester doing the internship in NYPIRG, and I am also on the board of directors for NYPIRG. It's a student-led board.
Awesome.
Yeah.
And so how do presidential elections affect NYPIRG, and what happens in NYPIRG during election seasons?
Well, something that we say often and throughout NYPIRG is that we are a nonpartisan nonprofit organization. So technically, and so we don't take stances on like politics at large, right? So we don't promote, like we do, obviously, as everyone knows, we do voter registration, but we're here to promote voting. We're not here promoting like one particular candidate. We do obviously have laws that we want to pass the New York Health Act. That's like something we work on, but we don't actually promote like specific candidates. Now, obviously, this was a big election, and the president-elect is obviously not in support of many nonprofits or really of many of the things we stand for at NYPIRG, and so that changes things for us, but we still don't specifically go out and support a candidate. But when a candidate doesn't support what we are fighting for, then obviously it makes things difficult. We can't ignore what's we are political, but we're nonpartisan. It can be really difficult actually to I don't know.
When we do our calls, doesn't matter which party the senator is from. We just make a call and we request to support, the Universal Health Act. We don't choose which one. It's like already those politicians that were elected, which is, advocate for what we stand for.
Yeah, totally. And so with SUNY Purchase discontinuing school-sanctioned healthcare, how would NYPIRG advocate for students seeking out healthcare?
Well, again, it's kind of the same thing with the president-elect. I mean, now that Purchase is not offering sanctioned healthcare for students, we're still here and we're still fighting for healthcare for all New Yorkers. Now, this does hit home. I'm a student here, and this is Purchase, and we no longer have insurance for students. But even prior to that, there were many issues that lied within, and still do, within the healthcare at Purchase. Insurance or not, the infirmary or the health service center is open 9 to 5, Monday through Friday. So even, on a Saturday afternoon, if there's a health emergency, it's still just as difficult. It still requires transportation to get to and from either White Plains Hospital or Greenwich Hospital. And without a car, these are all still things that prove to be really difficult. Like just before this today, I was making a call to Senator Schumer,
Yep.
urging to New York, or healthcare for all in all of New York. I was just reading, I think it's over 1 million New Yorkers that do not have any access to healthcare. So it just really, I think, promotes this issue that we are facing, cutting costs here and there, but it's just actually like cutting the cost of what students really need to like have safe and affordable healthcare.
That's why we are fighting for universal healthcare, one single payer.
Mm-hmm.
So right now we are spending fortunes in our insurance. When we cut one insurance because our parents, or myself, change a job, there is a limit of time that sometimes they don't take you straight away. So, New Yorkers, they don't have insurance for a certain time. If you go to an emergency, that will cost us less money. If, for example, I have a high blood pressure, if I go and check out to my doctor every 6 months, so that will prevent to have a heart attack. By law in New York State, they have to, see us in emergency room, and that costs a lot of money. And after, when it have side effects, because if I have a heart attack, that means maybe I have a side effects, and my family will have to be taking care of me, or those things cost money, and we can prevent it with just a checkup. Many of New Yorkers are scared to go to the doctors because they are scared of the copayment. That is insane. That's why we're fighting for universal healthcare, only a single payer. So it's not like doctors, and I checked with my doctor, what do you think about it? I will love it. Every time they have to do a test, they need to call the insurance and see which is the name or the number to, so the insurance are going to pay it. So yes.
I think, and on a Purchase aspect of it, I think it's really interesting considering, I came to Purchase freshly, or even this tail end of the pandemic. And so for me, it's really interesting to see like how the school reacted and just how New York reacted in general. And to then decide that the cuts need to be made are where health insurance lies. I don't know, I find that shocking, honestly, that they would do something like that. But then again, there's been times where I've had I would consider to be medical emergencies, and it was after hours. And so like the options were get an ambulance or have the UPD show up at your door. These are not this is not helpful when it's something that requires, or like even something minor. Like I had a friend break her finger, but it was after the health services had closed. And the easy thing would be to go and get it wrapped and to, see you later. But instead it was a matter of, do we call the police? Do we call an ambulance for a broken finger? And these are all things that cost thousands that we want to prevent. So yeah, to me, it's really a wonder as to why they would make cuts there, but.
Yeah. And so, what do you think will be like some of the big challenges for students navigating this transition into private insurance, or seeking insurance elsewhere, especially for those who had been relying on the school's insurance plan?
Well, I think a lot of like what Ines was just saying is that so many, specifically in New York, so many New Yorkers are fearful to go to the doctor, even if it's just for a checkup, because they don't want to pay the copays. And in college age, we're 17 to 23 years old. That's, it's a time where we're beginning to be independent, we're getting on our feet. And so now to have this added stress of okay, how am I gonna, even just to get my flu shot, okay, how much is this gonna cost me? How am I gonna get to the place I need to go? If they can no longer go to Purchase because no insurance, it's okay, I have to go to CVS. Is this gonna, it's a lot of big questions here, and I think just on a NYPIRG level, I mean, we're not really combating like the school's insurance in particular, but we are fighting for these acts that could potentially save so many. Yeah, what's the slogan they say for the New York Health Act? It's all in, lose nobody, something along those lines. But it's so true. Like,
the thing is, you need to understand the students, they have a choice, or to be with the parents' insurance, or have independently. Independently means the taxes that your parents are doing because they put you in this with the group should be separate from that, and and there you can maybe have Medicaid. But if you have insurance and it cannot cover, there is the option of COBRA, but it's a lot of money. It's very expensive. So the best option, and that is what we're fighting, is universal healthcare. So because it's the right for everybody to have, it's a basic life. So, yeah.
Totally. And do you think this change will disproportionately impact certain groups, such as low-income groups or out-of-state students?
Absolutely.
Out of the state of students, for sure.
Yeah.
I mean, low income, they can go through Medicaid, but, the out of state students, I have many of my students, they are out of state, and I say, what do you do if you have emergency? Nothing.
You hope you don't have an emergency.
Yeah.
That's a really stressful way to live,
If you live in a close state, okay, you can take the train or a car and go to the next state, New Jersey or Connecticut. But the students that are from California is not that easy. And, and sometimes the next states, they have an option for New York. Yeah, I think my father is a doctor, so for me, insurance is really important, and it makes me crazy.
It's a basic human right to
because
be able
like,
to.
I was raised that you have to have insurance. You have to be covered, because a car accident, your parents can lose everything because they didn't have insurance. It's crazy.
It's crazy, and I know several students who really did rely on this health insurance that the school provided. And I remember getting that email this summer, and I work on campus. I have an on-campus job. I work in admissions, and so that was a big head scratcher for me, was how can you promote this? This is something people need, and so it's kind of like, how do you put a positive spin on something when really, when you think about it, it's how many out-of-state students here really required that health insurance that are now kind of left in this weird middle ground of like, well, I hope I don't get the flu, It's really quite a lot to grasp, I think.
Yeah. And so with an upcoming Trump presidency, there is some talk of defunding or dismantling the ACA, which is also known as Obamacare. And so for students who are benefiting from these programs currently, how would NYPIRG be able to support them?
You never know because with Trump, we don't know.
He's unpredictable.
Yeah.
As we all know.
Maybe, he's talking about the funded nonprofit organizations.
Or,
NYPIRG is a nonprofit
the
organization.
school, the education system. So there's so much in the air. You could talk, like, when it comes to this presidency and what could be to come, there's so much, I think, there's so much that can be at risk. And that's no exception for NYPIRG. We're going to the next 4 years, I think, in a very uncertain state. Obviously, as an intern, we're just going to keep doing what we do. We're going to keep promoting these acts and keep making our calls and do what we can. But yeah, in the next 4 years, it could definitely be something that can be very destructive. So I guess really what we can do is keep going. It's not going to dismay us until
day by day.
Yeah, exactly. Day by day.
Yeah. And I was curious if you guys had any closing thoughts before we go.
Oh man.
Our next semester we focus in higher education. Like I was telling you just a minute ago, SUNY and CUNY, they are state schools, and we're fighting for better funded for SUNY and CUNY. So we're going to Albany to do the good loving. So everybody's invited.
Yeah.
I hope see you there.
Yeah.
And please follow us on Instagram.
Follow us, purchase NYPIRG. We're a lot of fun, and we update on what we're doing. Higher Education Action Day has been and is my favorite thing that we do in the internship. I learned so much. That's really where I got to see politicians like face to face and talk to them at a human level about, you know, healthcare or education or how I'm paying for college or how I get my insurance. Like that's really when you can sit down and see the reaction through these politicians and really do, it feels, you know, like you're doing a real part there. So I encourage everyone to get involved. You know, we're all students here. We all work here. We're all in New York. So what can we do?
You're student empowerment, and you have a lot of power. You're the new generation. So yeah.
Well, thank you for letting us talk
you.
about NYPIRG.
Yeah, of course. Thank you guys so much for being here today. And this has been a Purchase Broadcast.
Thank you.